So the third Women Deliver conference kicks off May the 28th in Kuala Lumpur. And to talk about some of the main issues in women's health, I'm absolutely delighted to be joined by Anna Langer, who is the Professor of the Practice of Public Health at Harvard University. Professor Langer, welcome. Now, since 2007, what do you think are some of the strides that have been taken in the area of women's health?
There have been important strides in terms of women's health since the first Women Deliver conference already 5-6 years ago. Some of the important indications of progress are, for instance, the dramatic decline in the maternal mortality ratio globally, and in some countries where maternal deaths are more common, very significantly too. So maternal mortality has declined by 30%, thanks to the efforts of governments, international agencies, researchers, activists, and a whole constituency of players. Another important stride since the first Women Deliver is the increased access to antiretrovirals that women have had, women who are HIV positive have had over the last few years. That has significantly increased with wonderful benefits for mothers and for babies as well, of course.
Where do you think some of the least progress has been made, both thematically and geographically? And what do you think some of the reasons for that are?
One area that has not seen the kind of progress we would want to see is morbidities, women morbidities. There are many conditions that are still not being addressed. For instance, obstetric fistula, prolapse, which is a consequence of too many pregnancies that are not well cared of. Mental health among women, which is a major problem. Depression is one of the main causes of high burden of disease among women, and there are still no solutions or efforts to address these conditions. Obviously, the emerging epidemic of chronic diseases, of non-communicable diseases. The world needs to do something to address the epidemic of obesity, of diabetes, of hypertension, breast and cervical cancer among women. So all those conditions we still need to focus much more on. Another area of limited progress is the women's health in urban areas. Most of the efforts so far have focused on women in rural areas who definitely need more attention. But women in urban slums have been completely invisible. And in this world where urbanization is such a global and important phenomenon, we need to pay attention to that very vulnerable population group.
So what more needs to be done at the point of care to tackle the barriers facing improvements in maternal health?
To tackle the barriers to maternal health care, quality of care needs to be improved. Currently, women have more access to institutional care, but still the quality in those healthcare institutions is very poor from a technical, interpersonal, and management perspective. Another area that requires more work is integrated care. Women should be able to receive the care they need for themselves and for their babies in the same place. And they also need to have an opportunity to access other services that may need at the same service delivery point.
Now, you were a speaker back at the first Women Deliver conference in 2007 in London. What did you set out to achieve then?
At the Women Deliver conference in 2007, I talked about magnesium sulfate, which is the most effective and safe drug we have to address eclampsia, which is one of the major killers of women during pregnancy. During that meeting, we highlighted the lack of access women had to magnesium sulfate and the reasons why that happened. Since then, some progress has been made. For instance, magnesium sulfate is now fully available in Nigeria, which is one of the countries where a large number of maternal deaths are concentrated. The Bill and Melinda Gates Foundation has also invested a significant amount of resources into research that will make magnesium sulfate available to women in rural areas as well.
So 2015 is rapidly approaching and the Millennium Development Goals deadline. What would you like to see in the agenda post-2015?
The policies that I would like to see in place for the next iteration of the development goals include those that will address gender inequity, those that will address the rights of women across the life cycle, adolescent women, women of reproductive age, and older women. I would like the development goals to be realistic and achievable, at the same time that they will be aspirational and will push countries to make progress. They should also be evidence-based, or at least evidence-informed. Those goals need to be rooted in needs and provide targets that are realistic. The policies I expect the next round of development goals will include are those that will encourage and facilitate comprehensive care for women's comprehensive needs. In other words, that the needs and the solutions are not limited to a particular age period or a particular condition, but rather address women as whole human beings. And that's something we can do and we know how to do. It's just a matter of implementing it.